Hi, I'm going to do an airway clearance with an acapella. So the first thing I'm going to do is check the patient's charts. So after I check the patient's charts, I noticed that they had a nebulizer treatment, so I'm going to do an acapella treatment with them. That way they can, since the medications help them loosen up those secretions, I'm going to go ahead and do an acapella to help them cough it up. So the first thing I'm going to do is I come and knock on the door, I check the ID band, wash my hands, and then I'm going to make sure I listen to their vital signs, or listen to their lungs, and then check their vital signs. And when I'm ready, then I will explain to them what I'm gonna have them do. And so here we have an acapella. So we don't want to do this with your nebulizer treatment. This can be after your nebulizer treatment to help you cough up secretions. I don't want you to cover up the end piece because it won't make that fluttering that it needs to be. So I'm gonna have you hold it like this, hold it like a microphone, and then I can have you rest your elbows on a table. I'll have you sit up, and if they can't sit up, I'll move the bed up. And so with this, I will set it at the lowest resistance to start with to see how they do with that. Especially if they are an elderly patient, we need to see kind of how strong they are if they're able to do it. So I'm gonna have you take a nice inhalation here, and then I'm gonna have you have a nice strong exhale, but I don't want you to have like a forceful one. So I'm going to have you inhale with it in, inhale, and then when you exhale, I want you to blow through here. And if you feel a resistance, I want you to keep going because that's going to cause that fluttering to continue in your lungs. And if they have any secretions, I need to make sure I chart down what the secretions look like. If there's copious amounts, if the color is, what the color is, if it has an odor, distinguished smell to it, just anything, what it looks like for the patient and how much they have coughed up. And if the doctor needs a sample of it, when they cough up, I'll have like a sample cup, and then I'll have the patient's name on it and everything, and I'll make sure that gets to the lab. So I want to have them do this too many times, only a few times, just because it can cause them to get lightheaded and dizzy, and we don't want that happening. If they do get lightheaded, dizzy after a couple times, we will wait until they feel up to it. We don't want to overwhelm them with this and cause them to pass out. So when we are done with this, we can place this into a bag. That comes with a bag here. And you can put the patient's name on it with the room number. You can place it in here. Instruct the patient not to wash the machine, as that can cause defects with the machine and it can cause it to stop working. You can set this next to their bedside if they need to do it again here later, or we can set it on the counter and we can come back and help them with it. And then we would go ahead after every treatment. I need to listen to the lungs and check their vital signs to make sure they're doing okay and make sure they're comfortable. Reposition them. If they were laying down, ask them if they'd like to lay back down. And I would always wash my hands before I leave the room, and then I would chart on the patient's charts what I did for them.